Shri Gurubhyo Namaha. Good evening, my dear friends. I am Dr. V. Pankajavalli. I had been a retired professor in anesthesia from the Institute of Anesthesiology and Critical Care in the prestigious institution Madras Medical College and Government General Hospital. My interest in pain and palliation made me take this topic for you all. So, being an anesthetist, I would like to stress the importance of pain and of the role of the anesthesiologist in conquering pain and palliation. As you all are aware, this is the ether dome, the amphitheatre between 1821 and 67, wherein there was an initial discovery of ether. The analgesic properties of ether was put to use and was a public demonstration. It was the first public demonstration because, as you all are aware, exactly a year earlier, Horace Wells made a public demonstration with ether and the patient cried in pain and they all said, "Oh, it is just a humbug," and they mocked at him and went away. In the next year, on 16th October 1846, our William Thomas Green Morton, he, a local dentist, he demonstrated the use of ether for removing a jaw tumor on a patient, Gilbert Abbott. The surgeon was Warren, and after anesthetizing the patient with open drop ether, Warren removed the tumor. After the surgery was over, the patient recovered and he said, "Oh my God, I just knew my neck was scratched and nothing more than that." So everybody commented, "Now man has conquered pain. This is no humbug." Yes, my dear friends, it is no humbug. We are the masters in anesthesia to conquer pain at any cost, and day by day our field is progressing, and today we have got very safe anesthetic agents to make the patient undergo many varieties of surgeries which were unheard of in the early days. So, as you all know, being an anesthetist, we have to know to conquer pain. So, we should know our fundamental nociception. What is nociception? It is the sensitivity to a pain stimulus. So, as we all know, we have a peripheral nerve which has a body in the dorsal root ganglion and which ends in the dorsal horn. This is the first order neuron. This will get relayed to the second order neuron, which takes our sensory input into not only pain, all the sensory inputs, the afferent loop is carried over to the brain. So, the sensory nociceptors, they have many free nerve endings. They are very small areas, which, because the more smaller the area, the greater will be the acuity of the pain perception. Most of them are A delta fibers, myelinated A delta fibers. They go to the dorsal root ganglion and to the dorsal horn. So, whenever there is a trauma or injury, the intracellular contents will get triggered. The peripheral nerve gets either all the chemical mediators are released, either a substance P, bradykinin, cytokine, 5-HT, histamine or prostaglandins. These are released and they carry the inflammatory response. So, this message is carried on to the dorsal horn. Now, when it reaches the dorsal horn, again mediators are sensitized there. This is called as the central sensitization. So, whenever there is a pain, we have to effectively treat the pain early and prevent further episodes of triggers to prevent a central sensitization. As you all know, the dorsal horn has got a synapse, a presynapse and a postsynaptic membrane. Whenever the impulse with pain comes through the dorsal horn, some of them get carried over to the opposite side of the spinal cord and they are carried up to the hypothalamus and brain. Whereas some, supposing that is not carried on immediately, there happens something called a central wind up. So, this what happens is, there is a NMDA receptors postsynaptically which will trigger more sensory pains and stimulus. Again they go back and trigger. This is the main reason for chronic pain. That is why these NMDA receptors are acted upon by many drugs like ketamine, which has a profound analgesic response in this blocking the NMDA receptors. As you all have seen, there is one more happening that occurs in the spinal cord, that is called recruitment. Whenever the neuroanatomical reorganization happens at the peripheral nerve endings, there is pain stimulus goes to the central dorsal horn, it goes to the upper and lower lamina. So you get what is known as a recruitment to the adjacent segments. Once again, the NMDA receptors there also get stimulated. So the recruitment worsens the central wind up. So this results in chronic pain. So now normally these are the anatomical pain pathways. As we all can see, R is the nociceptor and it carries the sensation, pain sensation stimulus to the dorsal horn by the afferent nerve fiber. Again they are of two types, myelinated A delta fibers and unmyelinated C fibers. For A delta fibers are for acute pain and the C fibers are for chronic pain. And in the dorsal horn grey matter, they cross to the opposite side and they are mostly on the lateral and posterior spinothalamic tracts, and they ascend up to the hypothalamus, and from there, this is the second order neuron. From there the third order neuron takes the messages to the cortex to the respective